Connecting our community with information about issues and opportunities.
Hey, good Sunday morning and welcome to Bridges. As usual, I am so happy to have you with me. Listen, did you know that breast cancer rates are 42% higher in black women when compared to their white counterparts? Take a look at this particular graphic that we have in front of you. You will notice that the incidence of cancer, and these are raw numbers, these are not percentages, the incidence of cancer in breast cancer, colorectal cancer, lung cancer, all cancers are substantially higher for black women than their counterparts. That is true in Lucas County, that is true on the state level for most of those cancers, and it is also true on the national level for most of those cancers. This is a critically important conversation, and we're having it with two of the experts on this issue in our community. I'd like to introduce to you Amber L. Curry, who is the Minority Breast Health Coordinator for the Komen, Susan G. Komen Foundation of Northwest Ohio. Welcome, welcome. I'm so happy to have you here. I've heard such great things about you. And with her this morning is Robin Charney. Robin is with ProMedica Health Systems, where she is the Oncology Outreach Coordinator. Robin, thank you so much for joining us.
Oh, thank you for having me.
So as a black woman, I have to tell you, every time I look at a set of statistics, I think, you know, how are we ever going to get better? How are we ever going to get better? Our outcomes for most health issues across the board are just not good. And these issues, these numbers for breast cancer are alarming. Now, we talk about this a lot. We talk about the importance of screenings. We talk about the importance of taking care of yourself. We're going to talk a little bit about it soon about breast awareness. But what's going on with black women and Latino women when it comes to breast health? Amber, what are we not doing?
Well, many women are not going and getting those annual screenings, you know, each and every year. So they may do it 1 year and then wait maybe 5 years later, 10 years later to do it. And that puts them at a higher risk for being diagnosed with a late-stage breast cancers, which are harder to treat and, of course, more costly. And then the prognosis is worse for those types of late-stage breast cancers.
You would agree?
I absolutely agree with Amber, and because of what we've read, we know that even though white women tend to be diagnosed more, women of color die more from breast cancer. It's just unacceptable. We don't know all the reasons. We do know that a lot of times by the time we see women of color in our cancer centers, that they've already have a later stage cancer. Now, when we talk about stages, just to make people kind of aware, in early stages, we're talking about the size of a tumor, if it's the cancer has spread, if it's located in lymph nodes, if it's in lymph nodes, and when it's later stage, it starts. We might see it in a lymph node, and when we say late stage, we're talking about it's already spread through the body. So if a woman of color presents with a later stage cancer, it is more difficult to treat. Sometimes the aggressive cancers, we see the aggressive breast cancer in African American women. We don't know if that makes it harder to diagnose earlier, but certainly what Amber said about having, you know, those yearly screenings and staying, you know, on top of it, you know, we're hoping will make a difference.
So when you say that you see more aggressive and deadlier cancers in black women, is that again just because they're coming in so late for treatment, or is it because we are somehow vulnerable to a more virulent form of cancer?
Yes, African American women and Hispanic Latino women are more likely to be diagnosed with aggressive types of breast cancers, such as triple negative breast cancer, which means it's just negative for all three of those hormone receptors used in treatment. And so instead of a more targeted therapy for that specific tumor, that patient has to go through a more harsher chemotherapy regimen.
Any idea why that is? Is it lifestyle? Is it biology? Any thoughts? Any research out there that talks about?
There's so many conversations about this, and there's a lot of research.
So what
and
are
we
some
can
of those
never say
conversations, Robin?
exactly what the one thing is. It seems like it's just a collusion of all of these things coming together. It could be genetics. We know that in men and women of color, a lot of cancers are more aggressive, you know, and of course prostate cancer in African American men is much more aggressive than in white men. We know that access may be a barrier. We have to look at the barriers. Okay, what is the access? Are we in the communities where people need to be? So if we're in a community where people are, the access will be easier because we're looking at transportation, child care. I mean, there's all types of you know, barriers just to getting to where a healthcare provider may be. You know, we just need to do better with that, with being in the communities and being familiar with the women, and so that they trust us more to come and know that if they are diagnosed, we're going to do everything we can to take care of them.
Yeah. So I mean, that sounds like that sounds a little hopeful to me. That sounds a little hopeful.
Yeah.
Would you agree?
Yes, definitely. There are steps women can take that may reduce their risk of breast cancer.
Let's talk about that for a minute. And I want to talk about this a lot throughout the show today, because I really do think that we have to help folks become responsible for their own health. We have to empower them, and I don't really like that word, but that's the only word I can think of right now. We have to give folks the tools to allow them to be responsible for their own health and make the choices that they want to make regarding how they want to live. I mean, it's not our place to make those decisions for people, but we absolutely need to make sure that the playing field is level here. So what are some of the steps that people can do themselves?
Well, they can first, of course, know their risk. So know if there's a family history of breast cancer or even ovarian cancer in the family, because that will put women at higher risk for breast cancer. They can then talk to their healthcare provider about their risk. So if they're at higher risk, that provider can determine what screening practices are right for them. They can, of course, what we're talking about, get screened, right? Women need to be going and getting their mammogram screening starting at age 40, and then also a clinical breast exam starting at age 20, at least every 3 years, and then at age 40 every year.
So the clinical breast exam, that means an exam by a provider. We're not talking about a self-exam.
Right.
All right.
Yeah. With, you know, Donnie, you and I probably grew up in a different era where, I mean, we were supposed to do self-breast exams every month and know, you know, and try to feel for lumps. And over the last few years, they've said that actually, I mean, the clinical breast exam is more effective once a year. The mammograms are important, but know your body. And Amber was talking about this earlier. You know, understand your body. You know, and how you may understand when something's different. If something feels different,
something's different.
Yes,
Absolutely.
and we don't want women to just be feeling their breasts. We also want them to be looking for any visual changes, because 6 of the 8 warning signs for breast cancer are actually visual. So that's why it's so important for a woman to just be familiar with her breasts, know how they look and feel, so that if a change occurs, she can report it to her healthcare provider.
So I want to talk about those visual signs, but before we do that, I want to say I'm really excited to hear now that we don't have to do self-exams, you know, because I always felt guilty when I wasn't doing them. But, you know, Black women have such a high incidence of fibrocystic disease. I happen to have that, and I could never tell what I was actually feeling. Everything felt the same to me, and so I felt as though I was putting myself at risk for not doing that, for not doing those exams. But so it's good to know that now the standard is a clinical exam. Amber, let's scoot through quickly those visual signs, and then we'll talk about them more after the break.
Okay, so some visual signs would be any nipple discharge. It can be a rash on the breast or on the nipple, pulling in any parts of the breast. It can be the
Pulling
side,
in?
yeah, like so a dimple or indentation. Of course, a pain in a spot that doesn't go away after a period of time. So
All of those things.
Yes.
All of those things should cause you to do what? Do you look at them to see if they get worse, or do you immediately call somebody?
What I tell women when I talk to them is you need to contact a healthcare provider when you see the difference.
When you see it.
And not waiting until after your daughter is married or until after you get back from wherever you've been.
Right.
You give a call that day and say, I see a difference. And I need to be seen,
Alrighty.
and demand that you need to be seen.
You need to be seen.
And
Okay. Well, I'm gonna stop you right there because we're gonna have to go to a break. But please remember where you are because it's an important point that you're making. We're gonna go away, but please stay with us. We'll be right back.